I'm Dr. Montserrat Andreys. Welcome to Hey Doc Podcast, a space where we chat, laugh, and share stories of Black, Indigenous, and POC healthcare providers. We inspire young folks to become doctors, deepen connection in our community, and dive into the complexities of our stories. This podcast is designed to be listened to, watched, liked, and shared. While you're listening, pop over to Instagram and TikTok to see photos, quotes, and these doctors busting a move. And don't forget to subscribe so you don't miss an episode, and please leave us a review. All right, let's get started. Luvjonez, kick us off with a beat. Hey, Carrie, welcome to Hey Doc Podcast. How's it going, Dr. Hsia?
I'm doing pretty good. How are you?
Doing all right. I'm so glad that we finally got to do this.
Gosh. Yes, I'm excited.
Yeah, thank you for joining us. So, as you know, a lot of the conversations that we have here are kind of all about our experiences and our identities as BIPOC docs. And so I would love to start with if you could say your name, the way that your family would say it, the way that you would say it if you were, like, say, at an interview or a formal setting.
My full name, Carrie Hsia. My parents just call me by my Chinese name, Gane. I just go by Carrie. But Hsia is pronounced the S-H-A-W. As you can see, the spelling is a little confusing, but it's pronounced Hsia.
Hsia. Cool. And what would you describe as your identities?
Identity: cis, female, lesbian, and I go by, you haven't asked the pronouns, but she, her, her, she, her, hers, they, them.
Awesome. And I always like to get into the really deep questions first. So I'd really like to know what your favorite study snack during finals was.
During finals, now you're just pulling it back, even though I've been thinking about this. Gummy bears. And actually during finals week, my sister would send me boxes of snacks. One time she went to Hong Kong and brought some back, so it was actually a bunch of Chinese snacks. Those are my favorite go-tos.
What are some of the standout, like, elements of what makes it a Chinese snack?
Gosh, this, what is it made out of? Tofu skin. It's like a fried tofu skin with the seasoning. I have no idea what the ingredients are, but it's crunchy, chewy, flavorful, little delicious morsel.
Yeah, that sounds great.
Yeah. And random candies.
And where did you grow up?
Yakima, Washington. Central Washington, if nobody knows where that is. Very small town. It's grown quite a bit now. It's currently more known for its hops and beers. It used to be more known for fruits, apples, wines. Now it's wines and beers.
Nice. They kind of like stepped it up.
They stepped it up for sure.
And what was it like for you growing up in Central Washington?
I feel like we had a core of kids growing up that were Chinese. So very small town, and there were a handful of Chinese restaurants owned by Chinese families, and we all knew each other. Some, their chosen family. One of my cousins, she's down in Vegas now, had this restaurant, and that's where we'd go after school. That's where we go on weekends. That's kind of where babysitting was. So we switched back and forth from Ding Ho restaurant to Shangri-La. And then young age, it was a restaurant called Peking Palace. So growing up was this handful of Chinese kids that just went restaurant hopping.
Nice. Were all of the families from the same region?
No.
No.
Actually, I'm not even sure how they all knew each other. I know my mom had a friend that lived there, and that's why she moved to Yakima specifically. But everybody else, I honestly have no idea how they all knew each other. I think it was just a small town. Somebody knew somebody who knew somebody, and they all came together.
Yeah, banded together.
Yeah.
And then did you go to high school in Yakima?
I did.
Yeah, how was that?
The first school I went to was very white and privileged. I don't know if it's still like that now. It was called Eisenhower High School. And all my friends were white.
On purpose, or was that the uniform?
I think that was just the uniform. There was an international club, so we joined it. And just to meet other people. I know I had a couple of Mexican friends. We had a couple of the Asian friends, but it was definitely about 97% white.
Okay. Was it pretty smooth for you all, or was it just kind of flying under the radar?
I think it was definitely flying under the radar. I was the kind of person that just got along with everybody. I was in sports. I was in the math club. I was in the international club. What else did I do in high school? Most of the time it was just kind of let's just hang out with our small core group. And then my senior year, though, I did transfer to the other high school, left all my friends behind because the summer between junior and senior year, I was playing basketball. And this other team was just so diverse. There was so many different shades of color that I was just really excited to play with them. So senior year, I transferred schools. And it probably ended up being one of the best decisions. My mom didn't like it because that was kind of known as the bad school, all the stereotypes and all that. But it was probably one of the best decisions I've ever made. And I met so many different people. That's when I found a group of friends that were a little bit younger than me. But it turns out that out of 6 of us, 5 of us were queer growing up.
Wow. So were you all out in that senior year in high school?
No.
No.
But yet we felt safe around each other. Yeah. That was, even to this day, I just thought it was just one of the best things. It's wow, how did the universe just pull us all together?
Yeah, that's pretty amazing. Do you still keep in touch?
With one of them, just once in a while, like a Facebook something, but mostly no.
And so then after high school, did any of them go to the same university you did, or was that kind of just a golden year?
Well, I went first because I graduated first. They were all juniors.
That's right. Mm-hmm.
I think even one of them was a sophomore. I don't remember. I actually don't remember what they did after.
And where did you go to university?
I ended up at the University of Washington, but I started off at Yakima Valley Community College.
Yeah, community college. Big ups.
Cheapest way to go, easiest way to get into university. I don't know if people know that.
I am such a big advocate for community college, actually. Yeah. And I know it would have been a really, really tough sell for me, but now that's what I tell everybody as well. Save money, go to smaller classes with teachers that really want to be teaching undergrad and like 100 level classes that aren't just kind of phoning it in. And then once you've saved money and actually learned something the first 2 years, then go into a big university program.
Yeah, and it's just a little bit easier.
Mm-hmm. Yeah, well, it also is so much more personal, right? Like I remember,
that's probably why it's easier.
Yeah, there's my psychology class had 800 people in a lecture hall. Like, how is that? How is that supposed to work? I don't know. But so if you can be in community college with 25 people, like, yeah, you're going to actually learn the material. It's way more accessible that way. But
where the professor knows your name instead of just a number.
Mm-hmm.
Yeah, I agree.
Yeah, totally. And when you were at UW, like, how was that for you going from community college into the UW system?
Amazing, because it was so big and there were so many Asians around, and there was a LGBTQ club, very small when I first got there though. It was, even though it was big and it was hard and it was university and it was school, I had a lot of fun. But that was also the year that I came out. So there was lots of partying going on.
Stretching those wings.
Yeah, I should say that was my first round at the university. Mm-hmm. I should say that. Because then I returned several years later.
Cool. Did the LGBTQ club play a big role for you while you were a student?
So when I first got there, it was in I'm going to date myself now, 1999. And it was in a very, very small office. And I remember walking in there, and there was one other person sitting there with one couch and a very messy office. And I just took one look around. I was like, hey, I'm just checking this place out. We exchanged some words, and then I left and never came back because it was just kind of like not organized. There was nothing going on, and this person was clearly just hanging out. Mm-hmm. But when I returned in 2006, the Q Center had started. It was an actual like space. The director, Jen, started it. I can picture her last name, but I can't remember it. But she kind of built this amazing space for everybody. And so in between classes, people would go and hang out. It was a safe space for people. They can just study, they can play games. And that was probably my favorite place to go to. I ended up volunteering there for one of my classes when I had to get some community hours in. So there is a very big space there now, but back in the day it did not.
Yeah. Well, I'm so glad for that change.
Yeah.
It sounds like at least it got started and then went in the right direction.
Yeah, it definitely did.
And then what was your major when you were in school?
General biology. It's easy. I knew I wanted to go to med school, and biology is the easiest way to go. Mm-hmm. And because I'm a late start, I just didn't want to deal with anything else, and I just went straight through. However, I do regret it. And I kind of wish I took other classes to kind of expand more of my interest versus get this done, be a doctor. You're already 10 years older than everybody else.
In retrospect, what do you think you would have wanted to study?
Something in arts.
Yeah.
Something more fun.
I approve.
Something like what you did.
And then how did you come to knowing that you wanted to be a doctor?
I think part of me kind of knew. I didn't have like a solid, this is what I'm going to do for sure. But when I was probably 18, I took my first biology class. I think I was 18. And I think the teacher at a community college made such a big difference that I loved science, and I loved everything that he taught me about science and how it related to the human body. So that's probably where my passion for science came from, was him.
What was it about this teacher, do you think, that was different from all your other science teachers?
It was how he explained things. It was how he explained even the simplicity of mitosis and meiosis, and the importance of cell division from the very beginning, and just relating it to cases. So that's what was interesting. Like cancer cells.
Yeah, the power of a good teacher, man.
The power of a good teacher. I have no idea what his name is.
Yep, but their legacy lives on.
But it lives on, yes, yes.
And how did your family react to you wanting to be a doctor?
I mean, I feel like every Chinese parent wants their kids to be either a doctor or a lawyer or an engineer. And after I dropped out of undergrad the first time, they pushed and pushed and pushed and pushed. And I said, no, no, no. I don't like being told what to do. To this day, don't tell me what to do. But you can ask nicely. And finally, my sister stepped in and said, leave her alone. I don't know what my sister actually said, but something along the lines of, leave her alone. If you keep pushing her, she's not going to do it. Mm-hmm. And about a year after that, I said, I'm ready to go back to school. But yeah, they're supportive.
Yeah, they were okay with it.
they're okay with it.
Why did you leave undergrad the first time?
The truth is, I was out. I was gay, and the only gay people out there were out at bars. Mm-hmm. And I was out drinking probably every other day. And I just wanted time off. At first it was like, I'm going to take a year break because I really want to discover myself. I want to figure out this whole new world. And then a year became 2 years, which became 3 years. But that's kind of where I found the queer community, was at bars. Mm-hmm. Just went out dancing, went out hanging out, like anything.
Yeah, well, if it's the beginning of that part of your life, I could imagine how you were like, I want this every day.
Yeah.
Do you think it would have been different if you felt like you could have been more integrated all the way along?
Yeah. Yeah. Instead of what it felt like it was very freeing. And I think that's just a word. It just felt very free and happy.
Yeah. I could see that. I would totally be like, that's where I'm going to go spend my time too.
Yeah. Yeah, exactly.
Yeah. Do you feel, I think that there can sometimes be a stigma about starting university, because for so many of us in our families, it's like, you're going to go to school. And you and I both did that. We both went to university for a time and then left and then lived a lot of experiences and then came back to it, which is really a fortunate element of living in this country. Like, it's not necessarily always possible in a lot of school systems. Mm-hmm. But do you feel that taking that break and taking that time and kind of figuring out what was actually going on in the world made any changes for you by the time you came back to the university the second time?
Definitely. I think I realized I didn't want to do what I was doing because it wasn't fulfilling. I wasn't helping anybody. If anything, I was ruining their lives. I was in loss prevention. So the people I caught were POC kids. And now I think back and I feel horrible. They're just trying to survive. They're trying to get clothes on their backs. They're trying to, their parents won't buy them something because they don't have enough money. And then here I am, the big bad person with the handcuffs. It just wasn't what I wanted to do.
Yeah,
I wasn't helping anybody except for corporate.
Ooh, especially right now with everything that's going on, you've probably had a lot of moments of thinking back.
Yeah. They're fine. They have money.
Yeah, the corporations are fine.
Yeah.
Yeah. Ooh, yeah, I could definitely see how then you were like, all right, loss prevention during the day and partying at night. And you were like, time for something different.
No, yeah.
And then how did you decide that you wanted to be a chiropractor?
It was actually brought up to me a long time ago when I was going through school the first time around. And I didn't know about it until my back gave out on me. And my first girlfriend at the time was like, come see my chiropractor. What's that? And all I did was reach over in my car and try to close the door. And so I went and saw him. I think I got adjusted twice, did the stuff he told me to do, and I was up and walking. Fast forward that about 10 years. I'm trying to think of the timeline. Yeah, 10 to 12 years. Okay, I'm back in undergrad. I'm doing my stuff. And I finished undergrad, actually took another time off. And during that time off, somebody else had reminded me about chiropractic. Because when I went back to undergrad, I graduated in 2009. And I wanted to apply for med schools. And I knew with my GPA at the time, I would have to apply to med schools, not the big med schools, but the smaller med schools. Mm-hmm. But somebody had reminded me about chiropractic, and I thought about it for a while, and I was like, I would rather do that. I don't want to push medication on people. Mm-hmm. I want to do what this guy did to me 10 years ago. Mm-hmm. It's natural medicine. I felt better. I felt great. And I didn't take any medication for pain.
Yeah. And then how did you choose the University of Western States?
First, I actually really wanted to go to New York. Mm-hmm. I wanted to get as far away from the Pacific Northwest as possible. But it was close, and I actually went on a tour, and I loved the view of Mount Hood. You know which view I'm talking about. It's that walkway, and I looked over, and I absolutely fell in love with it. And another person that really, really made a big difference was how friendly Lisa was in admin.
I love her.
Lisa Wilson.
Yep.
And Natasha French, how friendly they were. Yes. Those were the two people that pop up in my head when I think, why did I choose that school? Mm-hmm. It was so personable. It was so small. And the view.
That view of Mount Hood in the morning with the sunrise when we had to be there at 7:30 in the morning.
That's my absolute favorite.
It made it worth it. It was really lovely.
It really was.
And how was that program for you?
Overall, hard. It tested me to my limits. It caused me to have like my first breakdown. I knew I was smart, but I never knew how far I could have pushed with my brain. Would I go through it again? If you wipe out my student loans, I probably would.
Oh my gosh.
Wouldn't you? If they wipe your student loans out right now?
Oh my goodness. That would be incredible. I own a big house on the hills in my brain with that student loan. I can't afford a house because I have a house in my brain.
Well, that's what we always talked about. I think it was probably like 10th, 11th quarter. It's like, would you do this again if they said you can go through it for free and they'll pay for your past student loans? Yeah.
Yeah, it would be awesome actually to go back through it once you already know like 70% of the material. You know, it would definitely.
Now, you know 70% of the material. I'm in a different field now, so my brain's a little mush.
Yeah, so tell me a little bit about that. What's it like being a medical examiner?
Right now, during the pandemic and the election year, it's really tough. But overall, it is very rewarding in a completely different way than chiropractic is. Chiropractic has the instant reward. As soon as you have the adjustment, as soon as you do soft tissue work, they walk out and they appreciate you so much when they walk out. I don't get that now. So the reward I get is angry patients walking out my door because I deny them of a card, but they come back a couple months later and thank me because they went and saw their doctor and they almost had a heart attack, or they were close to having a heart attack, or something was blocked 70% in their arteries. They were close to heart failure, stuff like that. So it's not that instant. It's the you saved my life 2 months after I see you kind of thing.
Yeah, that has to be a completely different kind of gratification.
Yeah, definitely. I think the first time I heard the news, I got a phone call from my assistant and I just immediately started crying that I saved a life and possibly more, because if he was driving a truck, that could have impacted families that were surrounding him. Yeah,
for sure.
Yeah,
that's so cool. I love hearing those stories from you as well. In your time as a chiropractor, what was that like for you?
I loved it. I worked with the queer and trans community at ASHA, and the space was safe, it was inviting, it was friendly, it was happy, and I enjoyed every single one of my patients. We had conversations, it was personable, and I miss adjusting people. That's it. I miss adjusting people.
Yeah, it sounds like it was in creating a safe space and welcoming space for patients. It feels like it also created that environment for you as a provider.
Oh, definitely. I had bow tie Tuesdays, which I can't have now. I can, but probably not the best choice. Yeah.
Have you had any negative experiences with patients that made you feel fearful?
Currently, where I'm at, all the time.
Like what kind of things happen?
Racial comments, telling me I don't know how to do my blood pressure, and that, hey, darling, you better do that again because you did that wrong. Because there's no way my blood pressure is at 194.
Yikes. Yeah.
Yeah. Comments, microaggression, all day, every day.
That's a lot to be doing while also trying to just do your job.
Yeah.
Was that an experience for you also when you were in school?
The worst experience in school that is always in my mind. I don't know if you remember this because you were my TA at the time. It was fourth quarter. So soft tissue. I was outside the West Building, West Hall. I was sitting with probably about 5 or 6 other girls in my class. And this one guy walks by, because we had just gotten our cohorts for the next quarter. And this guy walked by and asked so-and-so, hey, what's your cohort? He said, D or something. It didn't match up. So this guy just says, oh, that's gay, in an incredibly negative tone. Do you remember that?
Mm-hmm.
And so I spoke up and said, you just used that in a negative tone. You could have used another word. Basically just kind of calling him out on it.
Mm-hmm.
Nobody there, none of the straight people who sat there stood up for me. Nobody spoke up. And he just said, who did that offend? It offended me. And I said that.
Mm-hmm.
And he said, oh, well, just trying to puff up a little. And then I asked him, does your family use that word? And he said, yeah. And I said, oh, okay, that's why. And I left it at that. And he did take it as I insulted his family. But you know what? Yeah, I did. I called them out on it too. So that was probably the worst experience there.
Mm-hmm.
Yeah. I mean, you were in my class. I was about like, okay, I need to chat about this.
Yeah.
You understand about this.
Mm-hmm.
I really want to strangle this guy. I hated the guy the rest of the time. And you know what? I really don't care for him now either. He's just mean. He was just a bully.
Yeah, it really was. It's interesting because I remember that day, and I remember when you walked in and you looked at me, and it was a look of familiarity. It was I was so grateful to be there, like so close to the event. Because I'm curious, like how else you would have been able to kind of discharge that, and you walked in and you just looked at me and you were like I'm not okay right now, and just, I think that kind of really speaks to, even though you and I have such different backgrounds and we come from such different families, we could have a shorthand for that kind of microaggression, and really that it creates a space that doesn't feel safe. It's that in that moment you didn't feel safe and you just needed to have somebody else to lock eyes with and be like, all right, this other person is going to understand and we'll be able to talk through this. And we go through these moments a lot, and they're always just kind of swept under the rug, and we keep going in these spaces and these institutions. And, here you are, you're Dr. Carrie Hsia DC now, and here I am, I'm Dr. Montserrat Andreys DC. But it doesn't mean that it was not only academically challenging, but also, you know, that who we are through all of those spaces also made it really hard sometimes.
It is. And I mean, as you can see, I'm still just angry about the event, like what happened. When I think about it, it's kind of like this internal anger. Mm-hmm. But the people that are around, I'm hoping that they do better and speak up. You know, one of them she's a big deal. She's like part of ACA. She speaks to classes. She speaks to students. She's going to do some big things in her life. I just hope I really hope she watches this and realizes you were walking next to this bully, and speak up. Yeah. And she is that kind of person. It's just at that moment, she didn't do it for me.
Yeah. I know I look back very similar to what you were saying about working in loss prevention for, you know, a department store. These last 6 months have been like a major, like, re-examination of so much of our lives and what we've done and how we do speak up. I know I've mentioned it in the past because I'm really working on this as a dancer and as a chiropractor, and, you know, I'm really working on my ableism because that is something that I really have not put a lot of my attention and focus on. So, you know, I know that even just in these last 6 months, like, I've learned so much about how I would behave differently, speak differently in different circumstances. And so in the same way that, you know, you've been reflecting on kind of your role in loss prevention in the past, and, you know, hopefully some other folks are thinking about the moments that they could have done something different and stepped up in a different way for people that are marginalized. And I feel like right now it also gives a different kind of permission to do that than we felt before.
Oh, definitely. And I feel like at this time, people feel like they have permission to do anything.
Yeah, I guess in either direction, right?
Right, in either direction. Yeah.
Yeah. What was your feeling on, I guess it wasn't, I wanted to say Tuesday, the election day, because it's a habit, but once the election results came back, and it was starting to look like Biden and Harris were going to be our next president and vice president-elect.
Wow. I took that week off. I just couldn't. That Monday, I went to work because I was going to try to power through Monday, Tuesday, because they originally didn't approve me to be off because we were short-staffed. So I tried to power through, but Monday, it's back to the giving them permission to say things and do things kind of in the negative way. I couldn't handle Monday. Monday was just really hard. So Tuesday, I drove to San Francisco. I got there and my cousin's like, do you want to turn this on? No, let's not. Okay, how about let's wait? I think she said, like, let's wait till 8:30 and we'll turn it on just to see. And then once in a while, I think we would turn it on like one time at night. And because we were like, we need to be with each other. We need to be here. We need to be with, you know, my cousins all down there are healthcare providers. They're all queer Asian and they're going through the same stuff I am. So we're like, let's just be present for each other. So I think by Friday, Nevada was the state we were waiting for? I'm getting dates mixed up.
We were waiting for Arizona and Pennsylvania. I thought Nevada just came through recently.
Because it was 6, we were waiting for 6.
Electoral college.
Yeah.
I think.
Yeah, I know. I was like, my brain just went. I'm looking at these like pretty lights that are shiny. Yeah, I think it was 6 electoral votes because he was at 6. Sorry, my brain's going crazy. Anyway, Saturday morning we found out. I woke up, I don't know what time, and my natural instinct is to reach for my phone, and I just got messages from people that was like, hey, we got Pennsylvania.
Yeah.
And it was, so when Obama won, it was excitement. It was like, yay, this is great. It is like time to celebrate, high fives all around. This time was more like, whew, we dodged one.
Mm-hmm. Yeah.
Like there is a little bit of celebration, but I feel like it's more like I can breathe now instead of hanging on to survive for the next 4 years.
Mm-hmm. Yeah, that is definitely what it felt like we would be bracing for, especially as healthcare providers. I was like, you know, all of our major institutions that we have always learned to respect, you know, the World Health Organization, the CDC, are experts that have been working their entire lives, that are the people we should be turning to right now, right? Like, this is an expertise for a reason. It is so complex. Not only the epidemiology, but also the socioeconomic factors and the way it's, you know, most affecting Indigenous, Latinx, Black folks. You know, I mean, it's really evident. So we need a plan that is multifaceted and not just kind of a blanket.
Yeah.
And so I know there were so many reasons for all of my identities, you know, that I felt a major relief. And yeah, and the healthcare side was one of them, but then also, you know, feeling like we would have a shot at like potentially not harming more people, you know, the harm reduction.
Yeah.
Yeah. So,
yeah. Even now, as you're speaking, I'm like, yes, exactly. The sigh of relief.
Yeah. The DACA recipients, you know, the people that feel discriminated against for religious purposes. I know the xenophobia has been really high this year. So many friends have just mentioned, you know, like a friend of mine almost got punched when she was out for a run, you know. And so it's been really, really hard to have leadership that is leaving some of the people behind and putting them in danger. Yeah,
a lot of people.
A lot
of people.
Yeah, and a lot of them came out and voted for their better interest. Thank goodness. And so, let's shake that out a little bit.
I know. Jeez.
0 to deep. So now that you are a doctor, and comparing it to what you thought being a doctor was going to be like, what would you say are some differences? What were you expecting versus what you got?
I don't know. I mean, I definitely didn't think I would end up where I'm at right now currently. I didn't think I'd be a stethoscope doctor. I don't know. I honestly don't even really know what I was expecting going into it, because going through med school, my brain was just constantly on a go. I guess I thought I would work with the queer and trans community, you know, and I did immediately after I graduated. Mm-hmm. But then life takes over. Life takes over, and then it goes a different path. But
yeah.
Yeah, I just took a detour.
If you hadn't become a doctor, what do you think you would be doing right now?
Wow. I had to become a doctor. Probably something in accounting. I'm just so good with numbers. It was so boring though. I could 10 key like crazy. It's just so boring, but I probably would do something with numbers.
Yeah, that's like the little Virgo inside of you peeking
It
out.
really is. I mean, I joke about it now, but I'm like, I think if I'm not a doctor, if this doesn't pan out and I don't succeed, I could be a mortgage broker. It's all about numbers.
It is. Yep. That's great. Well, now you know.
Oh, maybe.
What are some things that you would still be interested in learning? Not necessarily even medicine, but just in life.
Just in life?
Mm-hmm.
So many things. So many things. I'm jumping back in and trying to teach myself the ukulele. I'm jumping back into, I shouldn't say jumping back into, my plant stuff that I'm trying to learn how to keep them alive.
Mm-hmm.
So things I'm learning. I mean, my cousins down in the Bay Area, they love plants. So I think I'm just trying to learn some stuff to keep up with them.
Yeah. I approve.
Yeah. And, yesterday was the first day that I repotted some of my plants and I touched the soil without gloves. I know.
Oh, I'm so proud.
You almost fell back on your chair. That Virgo side of me. Can't get under the nails.
I'm so proud, Carrie.
And it was great.
How did it feel? How long did it take you to wash your hands after?
Not a lot because it was dry. So then, I just kind of did that a little bit, get it back in the bag. And no, it wasn't that bad.
Not too bad. Awesome.
I'm still getting used to the smell of dirt.
Dirt don't hurt.
Dirt don't hurt, but I don't like the smell.
And so if you were to talk to little baby Carrie, to like high school Carrie, or to first round undergrad Carrie, or second round undergrad Carrie, you can pick which Carrie you want to talk to. You can do that part. But what do you think you would give yourself as advice for navigating the world?
Wow. See, this is a question you could have gave me last week. Think about it on my 10-hour drive. Care less about what other people think. Mm-hmm. To all of them. I mean, even now, it's just there's certain things that's just care less about what people think and just do it.
Mm-hmm. That's such good advice.
That's it. Yeah.
Yeah. How do you feel like that would have served you better?
I probably would have done more things that made me happy versus making other people happy or doing what I think I should be doing in life, mm-hmm. following the steps of a successful life.
Yeah. What would you say to another Chinese queer person that is wanting to study medicine, that's maybe not sure if they want to continue or if it feels really hard right now?
Just be true to yourself the whole way. Don't change who you are. Don't hide. Don't... I feel my voice cracking.
That's when you know it's real. Right.
Yeah. Just be yourself.
Yeah. Do you have any memories of being in school or work where you saw somebody else in a fragile state like that, or like in a moment of maybe not being as safe, where you were like, oh, I know exactly what that is. I'm swooping in.
Specific time. More of my experiences with stuff like that is seeing my female friends in a situation they don't want to be in with a male colleague or patient or somebody of the male gender. Mm-hmm. So that's usually when I step in. Mm-hmm. If I sense that they're uncomfortable, or even when I know they got the situation handled, that's usually when I'll just step in as another body to be there. Mm-hmm. I can't think of any others. I'm sure there is, but somehow it's just not coming to my brain right now.
Yeah. I know for me, when I look back on it, I don't think I realized it as clearly at the time, but when I reevaluate it, I realized that that's actually a big reason why I became a TA in the chiropractic program.
Oh, yes. I don't know. Can I say that now on this podcast?
Can you?
I don't know. I'm still on their payroll. I'm going to say it anyway, but some of my favorite students are the POC females. And do they get more attention from me and more help from me? Yes, they do. 100%. Do the queer students get more attention from me? 100%. If somebody else asks me, of course I'm going to help them, but I do veer towards helping my community.
Mm-hmm. Yeah. I feel like I did the same thing. I made the same decisions, and it was because there was so much. The instructors were really wonderful and really helpful. Yep. And the program was really great, but there was such a preference for the tall, strong, athletic male, which were predominantly, not all, but predominantly white. And I think it was easy to default to like, a good chunk of you all are getting it, so everyone else will just kind of get it as well. And it skewed towards that population for sure. And so if there was any differences in like height or levers or reach or anything like that, it was like, well, figure out later in the open lab, or, you have some really, you'll laugh at this. One of our professors, anybody that's listening that went to our school, Dr. Partna, has quite possibly the largest hands of any human being I've ever known. And he was helping me set up an adjustment, and he looked down and he was like, Montserrat, you have some small hands.
Yeah.
And I was like, they're all proportional. I'm a small human, but.
I think you need to tag him on YouTube just so he can watch this one.
Oh my gosh, I think I will. Well, in that vein, he was also the person that demonstrated endonasal technique on me. So for those of you that don't know, it's a technique where you go in through the mouth and reach back towards a eustachian tube and then pull down. And so I had these, I have a photo of that actually. I should post it once this episode comes out. But there's Dr. Partna. He's this huge human being with these enormous hands, and like they engulf my face.
Oh, I can't imagine.
So, in the same way that like I cannot relate to what it is to be that size and that masculine and that, you know what I mean? So he definitely could not relate to being able to understand what I needed to try to learn to adjust,
Oh, yeah.
And so that's where the diversity in different people really paid off. And also one of the things that I saw in our program was that the men that were not very tall, they really struggled a lot too. If they were kind of shorter in stature, like I could tell that they were often very uncomfortable asking questions because they didn't want to feel emasculated.
Mm-hmm.
Because the program just skewed so much for that like big white able-bodied person. So, but yeah, it's
Well, I actually, because of you were my TA and you taught me how to adjust the way you adjust and how you modified. So when I became a TA, I also kind of veered towards the students that were under 5'5", So I would always approach and say, so this is how my friend does it. This is how I was taught. You should try it this way. And a couple of times, actually, if the shorter guys heard me do it, they'd actually come over and listen in also. So it's like, this isn't how I do it, but this is how so-and-so does it. Give it a try. So got to pass it on.
Yeah, totally. It's so necessary. It's necessary to just recognize that it's not because anybody is particularly capable or incapable. It's that in order to do the same things, especially with a manual medicine, right? You have to just be aware of the people that are on the table and the people that are working.
Yeah.
Like, it's just as simple as that.
Yeah, especially, well, in Dr. Bartner's class with cervicals, right? Things get very close.
Yeah.
So having a female in that class is essential. Essential. I would have 2 students who would specifically wait until open lab, and they would come to me and be like, we have female questions.
Yeah.
Show us how to do this without hurting ourselves or without exposing ourselves or without being too close to so-and-so. Like they would specifically wait until Wednesday night and then show up to open lab to ask me that.
Yeah. I know. It's really valuable.
Yeah.
Yeah. Especially in that program, it was hard to come by. And so I'm curious, what do you think we can do as providers ourselves, other BIPOC doctors? Like, what can we do to improve the demographics in medicine?
Exactly this, visibility. I mean, one of the reasons I love the idea of this was that you also have the video. It's just not hearing about it, so that you can see that I am masculine a center. I have a fade and a hard part. It's a very masculine haircut. Yet I identify as a cis female. And I became a doctor, and anybody can be a doctor.
You recently had a very touching experience on TikTok, which I would like for you to talk about, if you don't mind.
You're just hitting the topics where it's going to just draw out the tears. It was a very hard week. It was, racial comments about, it was the week where they said, hey, darling, you better do the blood pressure again, because I did it wrong, because I haven't done it over 5,000 times before that. And so I just remember sitting in my office, and I don't like being on video. I don't like my voice being recorded. And I didn't want my friends to know. So TikTok, bunch of strangers. At the time, I had like 10 or 15 followers. So I'm like, it's just going to be strangers. I'm going to let it out into the universe somehow. And just like, I'm frustrated. I hate this. I hate the world. I hate people. They're just mean. They're bullies. And it ended up reaching over like 200,000 people. People watched it. People supported me. And the outpour was just overwhelming. And they're just strangers. Like, I have no idea who they are, but there's good people in the world. I mean, I definitely have trolls that jumped in too, but those are immediately taken care of. I even had people on TikTok that said, give us their handle name. We'll take care of it. I know. I was like, oh, there's my TikTok army.
Yeah.
I mean, it's still pretty small. I'm definitely not like, a celebrity or anything, but somehow it was just, I had it. I needed to let it out. Before it was just like eating me up inside. So I go back and actually I watch that video once in a while because I'm like, I need that reboost. I go read the comments again because people are awesome.
Yeah. What kind of comments were you getting?
The good ones or the bad ones?
The good ones.
That I'm amazing. I'm just so strong. I'm there. And the one that always gets me is my cousin and I, we talk about this, is that we're being called heroes. And I'm not frontline in a hospital, but I am the reason people's toilet paper is getting delivered, or their Clorox is getting delivered. PPE is getting delivered to the hospitals. But my cousin and I talk about us being heroes, and we're like, we're just really just doing our jobs. But at that moment, hearing it sounds really nice. It sounds like I am making a difference. I am doing this. So a lot of, you got this. I'm sorry for all the hate. I'm sorry, the Trump supporters are bullies. There's other healthcare providers that are like, I'm queer, I'm POC, I'm a nurse, I'm frontline, I'm here with you, we got to stick together. And it's true, we're all in this together. And we just got to, if one of us falls, we got to lift them up.
Yeah, absolutely. I have been following, I'm sorry that I don't remember her handle right now, but there is a trans femme medical student in India that I have been following her journey through medical school, and the macro. I think the only people that call them microaggressions are the people that don't experience them, because none of them feel micro to me. I don't know about you.
You're right. You're absolutely right. At one point, it did feel micro. Now it is definitely macro.
Yeah, it's just aggressions.
Yeah.
Feeling threatened, feeling unsafe, being bullied. None of that is diminutive in any way. But so she posts a lot about her experience in India as a doctor, or a medical student, becoming a doctor. And between what your experience was with TikTok and watching her experience, one of the things that it makes me realize is how fortunate, how different this is than even 15 years ago, where we didn't have social media in this way. We couldn't find each other by just hashtag gay TikTok.
Yeah.
You know what I mean? Like the amount of ability that we have to actually be able to feel less siloed, less lonely, like you and Yakima 2 decades ago, if you had just been able to, hashtag like gay TikTok, that would have been a huge difference.
That would have been a big difference. Yeah. Now you're right. Hashtags. just the other day, I hashtag Asians. It's like, let's see what pulls up. It's a thing.
It's going to start getting real specific.
Yeah, I'll stop
for Latin folks, like we also have candy that's very specific in terms of flavors and tastes. And, you know, I'm curious, like if I just hashtag some of the candy, I'm sure it would come up.
Let's do it after this.
Okay. You know, but those are definitely the ties that bind, right? And like the things that make us feel comfort and safe and just kind of allow us to continue to move forward. And the statistics of our representation in healthcare are embarrassingly low. And I'm hopeful that things like this podcast and things like you being on TikTok, you know, that it really helps to change that for our country.
Yeah. I was actually, I think, listening to your first TikTok with your intro, and I looked up the stats, and Asian doctors, the stats are a little bit higher.
Mm-hmm.
I can't remember what the stats, but it's almost twice as high as Black, Indigenous, and Latinx healthcare providers.
Yeah. Yeah, we got to step it
So
up.
you know what? And I'm here to help you.
Yeah. We're just going to reach down that ladder and be like, come on.
Yes.
There's a party up here and we have food.
Yep.
What do you want?
Yep. Let's come party. Yep.
Oh my gosh, Carrie, thank you so much for chatting today and sharing so many stories. I know that a lot of them are hard to share. But I really appreciate it. And I know that people listening that share your experiences also really appreciate it.
We're all in it together. We're all in it together. That's all.
Totally. And go follow on this podcast description. You'll have Dr. Carrie Hsia's TikTok. You have it here on the screen. Shazam. Go check it out. We will be posting there soon in celebration of this episode as well.
Yeah.
And so thank you so much for being with us today.
Well, thank you for having me.
All right.
Bye.
Bye.
All right, everyone, that's our show for today. Please follow us on Instagram and TikTok. And if this episode hit home for you, let us know. We would love to hear how these stories reach you. Hey Doc Podcast is recorded at the Portland Center Stage digital streaming studio with the AV engineering, logo design, website, theme music, and editing all done by the incomparable Jonas Angelette and invaluable technical savvy of Katie Wen and Greg Lee. Instagram and TikTok management is brought to you by the fantabulous Jen Thompson. And if you want to see the faces of these BIPOC docs, you can watch the podcast on Hey Doc Podcast website, and you can listen on all of your favorite podcast streaming sources. Check out our fun posts of your favorite BIPOC docs on the Instagram page and watch them bust a move on TikTok. Thank you for every listen, share, like, and emoji. I am super grateful to all of you that tune in to listen and to all the wonderful docs that come share their stories. See you next time, friends.